Karen, last name.
All right, we are live on YouTube. Thanks.
Thanks, Donna.
So welcome to our annual Tompkins County Office hearing. So this event here is it's a hybrid. We're doing this in person. We've got people in our room and sharing on Zoom, and we'll have a PowerPoint. It's also being recorded for future viewings. We'll have time at the end and answers, hopefully. We can. Papers and pens if you need to jot anything down. Again, and if you are us, you can put your questions in the chat, and Karen will collect those and we'll review those at the end. I wanted to thank the advisory board members that are here joining us today. I see we have Bill Lesser in the back. We've got Charlie Hart, Carolyn Byers, and Joanne Zbiggy in person. And I'm not sure who we have on Zoom. Okay, so Carol Mallison is also one of our advisory board members. So thank you for joining us today. And I'm also going to let you know Karen Bullis, our deputy director, is the one that's in charge of the Zoom. You can't see her on screen. She's over here. She'll be over here toward the end. And I'll introduce Amy Jackson, our aging service specialist, who's here with me, and she'll be talking about our programs and services. Can everybody hear okay on the mic? Okay, go ahead, Karen. Okay. They're not so easy. You know, it's kind of hard, like coordinating all of this. We'll get it. So the mission of our office is to assist older adults and persons with long-term care needs to live independently in their homes and communities with quality of life and dignity. And I'll start going over the services of our office. We have these wonderful little guides here. There's Falls Prevention Resource Guide in Tompkins County. There's resources for caregivers, housing for seniors, and long-term support services. Those resource guides are in hard copy like this in our office, and they can be mailed to people if they request them. They also can be found on our website. There is a link directly to the booklets. And the services of our office. New York Connects, long-term care services, helps people to remain independent in their homes. We give information on home care, respite, and transport, among other things. All of these services, by the way, are found in our brochure and also on our website, all of these details. We have personal emergency response systems, and we have outreach workers that will go out and install these systems. There are GPS and landline connected per systems. That's the emergency response button that you push if you need help. We also have health insurance counseling. We counsel on Medicare, Medicaid, prescription drug coverage. We do information, referral, and counseling on a whole range of services of interest to older adults. We have the Caregivers Resource Center and Alzheimer's Support Unit. We have a caregivers library in our lobby. There's also a couple of different kinds of packets that are really helpful to caregivers in that library. There is a caregiver group that's held currently every other week. And there's a quarterly caregiver newsletter, and usually there are monthly workshops. There's a month or two here and there that it's not possible to bring those, but mostly we do those every month. There's the Project Care Friendly Visiting Program. That's a volunteer-based program. There are students and other community members that go visit older adults for companionship. Sometimes it's respite for caregivers. We have the Home Energy Assistance Program, or HEAP, that helps with home heating costs and furnace repair. And we have the Long-Term Care Ombudsman Program. The ombudsmen are advocates for those that live in long-term care settings. They can help them resolve problems and advocate for them. We also have the Falls Home Safety Assessments. We do those free of charge. We have a couple outreach workers that go into the homes and go one room at a time to look for any safety hazards. We have the yard work and snow shoveling list, which is both paid and volunteers. And when people call and looking for assistance with snow removal, or in the fall, obviously raking leaves, that kind of thing, we have a list of people that we could give them names and numbers for. The Senior Farmers Market Nutrition Program, that generally comes out late spring or early summer. The coupons this year were $25, and those help out people to buy fresh produce at the farmers markets locally. The Gadabout transportation tickets, we can give seniors up to 20 one-way Gadabout tickets per 12 months. So they can contact our office and we'd be happy to get those out. And for the contracted services of our office, these are subcontractors. There are programs that we subcontract. So Food Not Meals on Wheels, these are the congregate and home delivered meals. There's also nutrition counseling and education involved with Food Not. Lifelong does health insurance counseling. They do health promotion programs. The Senior Circle newsletter comes from Lifelong, Senior Planet, and the Mosaic program.
I'll talk about the virtual senior center later.
Okay. The Tompkins County Long-Term Care Services, that's case management in our ISIP program, the expanded in-home services for the elderly, and also caregiver respite goes through long-term care. Finger Lakes Independence Center has the registry program. That's a list of, oh, did I miss?
That's
Yeah,
okay.
I did miss them, sorry. Finger Lakes Independence Center has the registry. That's a list of care providers that are individual or private pay. So they link people with in-home, who need in-home assistant with independent people for hire. And I'll go back. Ithaca Neighborhood Housing Services, they have, they help people with repairs. This is for income eligible seniors to assist with health and safety to stay in their homes. And then Law New York, the legal assistance program of Western New York, we make referrals to them for civil matters. And then finally, personal care and chores or housekeeping assistance. We contract with caregivers, Home Instead, Staff Kings, and Finger Lakes Independence Center for the CDPAP Consumer Directed Program.
Great. Thank you, Amy. I just want to clarify a little bit. So the first slides about the services of our office, those are services, just to make it clear. I think people get confused about what we do sometimes and what we don't do. Provide those services. Those are programs and services we work on. And the contracted services that we're funded through our agency, from usually guided by the Older Americans Act. So we don't provide them ourselves. We find these great, amazing contractors that we have in the community. Contracts like, for example, Food Not Meals It's over 800. I think I'll show it later in the slide, budget slide. Over 800.
Lisa, this is Dominic. I'm going to need you to speak a little clearer into that microphone if you're going to use the one in your hand, just directly into it. That isn't working either, unfortunately. So if they can hear you in the room, you might just want to stick with the other one.
Can you hear me okay? I can project well. Is that
That
good?
is that's much better. Thank you.
Okay.
It was working for a while. Sorry about that.
Thank you for letting us know. So, from our largest contractor, Food Net Meals on Wheels, down to one of our smaller contractors, New York Law, we contract with them, but it's a very small amount of money that we fund to do that. But that said, a big part of our program is information assistance and referral. So we make it our business to be able to know what's in the community for people and be able to refer them and connect them, whether it's through our funded program or not. So I just wanted to make that clear. But to go into the actual reason why we're here today, it's required by the New York State Office for Aging for us to have a public hearing every year. The public hearing is an opportunity for the community to ask us questions, to provide feedback, to inform our plan for 2023. That plan is then gathered together, and our advisory board kind of gives its blessing after they review it, and we're able to submit it to the state and receive the funding that we say we're going to use. So it's kind of like that. We've also created a small survey link, 3-question survey for people to complete. Some people have completed that. That will continue to be open until the end of November. And if you don't want to complete that survey online, you don't have to complete the survey at all. We're here today to talk about it. But if you want to complete it without doing it online, you can call our main number and go through the questions with a person at the front desk. Let's see. So really, that final plan that is given to the advisory committee will reflect the comments and the suggestions that are made by the public. Let's see, we also have I think everybody picked one up today, most everybody, but our proposed plan abstract, we call it, is also on our website. If you scroll down on our main page, there's information about our public hearing, so you can get a copy of the plan abstract that includes most of the things that I'm talking about today. The abstract also includes findings from our needs assessment, from our age-friendly action plan, from customer feedback, program trends, program evaluation, satisfaction surveys, partners, and everywhere else we can find information to kind of inform the work that we're doing. So I think that's it, Karen. Go ahead. Those are the links to it either way. Not that you can click on them right now, but anyways. So our priorities, our plan abstract priorities, if you go through it, you can see that, we have the 28 programs that we administer. Kind of mentioned a combination of them that Amy talked about. We have 26 different contracts. We have 10 subcontractors, 22 different funding streams, which are super fun. 9 federal, 9 state, 3 local, 1 private grant, and we have 4 different fiscal years too. So that always makes putting the money together really fun. But that's all part of this plan and why we're here today. But some of the things that we're going to be continuing to do as we go into 2023 is our age-friendly work. I'm not sure if everybody's familiar with that work that we do, but we've been part of the AARP network of age-friendly communities, which is an initiative of the World Health Organization since 2015. We're in our second 5-year cycle now. We have our new plan and implementation timeline on our website of some of the work that we're doing with that. I have to say, a lot of the work doesn't come directly from our office. This is from our partners. We gather information together with what other people are doing to try to make it more of a livable community. Just an example of that is some of the work that Joanne and Rodney have been working on with the Snow Coalition. So that, those kind of efforts are what we try to capture in that plan, is what part of a livable community would want and need to be successful. Okay. Some more, I think that some more programs and priorities. Amy mentioned the personal emergency response system. That's something that of course, we'll continue to do. We find it, very important for people. Our numbers they kind of ebb and flow, I'd have to say. But, with new technology improving, we're trying to get, our efforts for outreach and getting more clients hooked up to our new GPS devices that are fairly new. Technology was a little sketchy. I'm looking at Tom because he's our PERS person over here. It was a little sketchy, but we've come to a place that they have pretty good equipment and we feel confident in getting that out there for people. And people are interested in that because it's not just that stationary button that you kind of have a radius around your home. You can actually wear this out in the community. So we're hoping to increase our numbers a little bit there. Our regional long-term care ombudsman program, again, Amy mentioned that this is a partner. It's a regionalized program, regionalized back in 2015, which is, I don't know, the magic year. A lot of things happened apparently, but it was 2015 when it was regionalized. We used to do it just for Tompkins County. We were awarded the grant to do Region 12, which is Tompkins, Schuyler, and Chemung counties. We've received some additional funding this year from we received from the CARES Act, we received some ARPA funding, the American Rescue Plan funding, to kind of strengthen the program, I guess, a little bit and hire a couple extra staff to help us visit and advocate in the facilities around the entire region. Really, some of those regions, well, things changed over COVID. I think most of the people know about, the difficulty people had getting into nursing homes and being able to visit and issues there. So it was recognized at the state level and we were given this funding to do so. It's a volunteer program. We have 2 staff that run the program for, I want to say it's almost 1,900 beds in the 3 counties. So that's a lot of people to advocate for. So these 2 additional staff are going to be like a temporary project assistant staffing to kind of get in there and really get into some of the issues that, maybe were looked over during COVID and whatnot. So that will start in 2023. Next slide. Our client satisfaction, RBA, we do the results-based accountability data. We just started it. We're one of the last cohorts in the county to start that process. And I think we've collected data for 1 year now. So this year we will actually have something to compare to the previous year, which is great. But that's definitely not the only data we collect. We make it our business to do satisfaction surveys on all of our programs. When we'll continue to do that with select programs, we usually rotate and we'll do I'll just say high cap, I think is coming up for 2023. So we take a percentage of our clients and we have an intern or someone call them to make sure that we're doing what we say we're going to do with these programs. So we also collect that data and use it for feedback for our plans. Caregivers Resource Center, Amy talked a little bit about that. Amy is the caregiver coordinator, so she knows all about it. In 2023, we'll continue to support the same programs and offerings that we do now with some enhancements, which I'll kind of talk about in a little bit. A new program that was started last year. I'm not sure if anybody remembers, maybe the advisory board folks remember the Pause for Parkinson's program that we got a mini grant for, which Dawn over here ran that. Luckily, we applied for another grant this year to kind of expand that. So it would go beyond just Parkinson's. But what it is it's a respite program created it was for just people with Parkinson's to give their caregivers a break, to do whatever they needed, matching students from Ithaca College mainly with the care receiver. And it was really successful, and they funded it a second time to kind of expand the diagnosis, I guess you'd want to say. We're following the same model, but it's not somebody that just has Parkinson's that will be able to be, we can offer it to more people. And we're just getting started with that. I think we were awarded the grant just a month ago. So we'll be working on that throughout 2023. And targeting it, the word is kind of getting old, but they still use it at the state level. But our efforts really are to target the most underserved populations. And we have to show that in our data that we're making those efforts. Throughout each program that we have, it's something that we're monitored on by the state. And we also monitor our subcontractors to ensure that we're really getting to serve those populations as well. Let's see. Policy trends. We continue to monitor the effects of current policies and legislation on our older adults. It really kind of informs what we do if we need to switch gears, depending on what's going on in the world at the time. It plays a pivotal role in what we do, especially, addressing the social determinants of health and bridging those gaps to keep people in their homes safely and independently. Some of the newer ones that we've been really looking at the past couple of years and will continue is addressing social isolation and loneliness, strengthening and supporting our caregivers. And when I say caregivers, I'm talking about informal, including home care aides, which we have a shortage of in the country right now, but also informal and family caregivers, and that's kind of where our caregiver program focuses mostly on that. We've been talking a lot about the Older Americans Act modernization. They oddly enough call it reimagining the Older Americans Act, which is, it's like all this reimagining stuff happening in Ithaca is crazy, but it's all good. But anyways, some of the things that the funding was intended for when the Older Americans Act was created have shifted. An example of that would be congregate meals. We could only use this Title C funding, specifically one part of it for home delivered meals and one part of it for congregate meals. Well, COVID kind of stopped any kind of congregating. So that was one issue, that what are we going to do with this funding? Under the major disaster declaration, we were able to shift that funding over to home delivered meals. So temporarily we were able to use it, but congregate meal programs have been dwindling for years. So kind of taking a look at those things and figuring out, what do people want now? I mean, are they still wanting the same things that they wanted when this was created? And how can we be flexible with that funding? So that's great that they're working on that at that level. Again, I think I mentioned addressing the social determinants of health, promoting health equity, reducing healthcare costs, or those kind of things are high on our priority list. Reviewing the long-term support service delivery system, and how populations navigate that. That's a complaint that we hear about all the time. Just no matter how many times that we've tried to say, think we kind of find a solution, things change. Medicare changes are coming, Medicaid changes are coming. So it's always trying to know what we need to know to navigate it and to be, a catalyst to advance change, but also to help people get their way through it. So the next slide is kind of what I was talking about, that some new initiatives that about caregiving and social isolation. So these initiatives were really spearheaded by NYSOFA, the New York State Office for the Aging. Through their budget, they were able to purchase these programs and services and provide them to the offices for aging across the state. So it's not things that are coming out of our budget directly, but they felt that they were really important and helpful. And many of them are like evidence-based programs that they found that have been successful in assisting caregivers or addressing social isolation. So you can see, you can pop those up. So over to the far left, there's a new caregiver portal. It's called TruAlta. Is it on there?
Yep.
Yeah. So that True Alta it's on our website. Really, it's a portal that anybody can sign up to that is a caregiver, informal or formal, to really help them navigate caregiving, support them, provide resources. Archangels is also for caregivers. This is really I want to say it's the right way here. My thing's not working. Hold on one moment, technical difficulties. So either way. So anyways, Archangels is really a program that the caregiver an index about their, what do you want to say, vulnerability, what their stress levels are as a caregiver, and provides them with resources, basically. And it will point them to local resources or national or state resources. So it's free. It's on our website, and people can, go into that and take whatever they want from it. Again, it's supported from NYSOFA. The Joy for All Pets. Yeah, oh, here's my Archangels. Yeah, so Archangels, yeah, they call it a caregiver intensity index is what it is. So you can go on there and you answer some questions and you can see where you fall, if you're in the red zone or in the green zone, or how stressed out. And this was created also because people were not seeing themselves as caregivers. They were just, maybe it was their spouse, or I'm not a caregiver. This is just what a spouse does, those kinds of things, but still could be supported. And these people would show up with big angel wings and like Walmart and hand out cards and say, you're a caregiver, look, check this out. So yeah, it's a pretty interesting program, but it is on our website also. The Joy for All companion pets, that is something I think everybody's kind of familiar with at this point, but we've been getting them out for years. We have purchased a few of our own, but most of them have come from NYSOFA, just funding us. They've asked us how many we wanted. We put in an order and they give them to us. And they've brightened a lot of people's lives up. Now we have a new one. It's called a Walker Squawker, and it's a little bird and it chirps. It's pretty cute, but it's kind of to help people with walkers, kind of remind them, hey, there's, don't forget to get up and take your walker with you. You got your little pet bird, but it's cute. People really do enjoy them. So, except we don't really necessarily enjoy them in the office that much because they're constantly chirper. Yeah, it's can get a little maddening, but they do turn off. So that's the beauty of it. Let's see, LQ, that's another, this is interesting. We have a sample in my office. It's not plugged in right now. We have 2 out in the community, I think. We were given 5 of these, well, I don't even, little robots, if you want to call them, but basically they're a voice operated care companion. And you can hardly see in the picture, but it's that little head there, and there's a tablet next to it. So it talks to you, interacts with you. It's kind of like, people see Alexa. Alexa's got a caregiver component now, which is good. This is a little bit more trying to target the social isolation piece. It actually engages with you. You don't have to call out LQ. It's going to ask you questions. In my office, I know they'll start talking during meetings and asking me how I slept last night, asking me how my pain is, things like that. So it's got reminders. It can call for help. It can call people. You've got the tablet associated with it. So you could actually do what do you call those? Telehealth. Yeah, you could do telehealth, or you could even just do a Zoom call with your family member. So it's pretty neat. And it is a pilot that I can't imagine how much they actually cost. But this pilot, it's gathering data from the person that's home it's in too. So it will ask them social isolation questions every few months to kind of see if their level of social isolation is improving. They don't feel as lonely or as isolated. So there's an actual scale that it's kind of gathering data at the same time. That, and then the VSC, which is something that we contract with Lifelong. And Liza could probably tell us a lot more about it at this point, but it's a virtual senior center is really what it is. It's offering programs and to about 30 or so lifelong members, we think. Is that 20 right now? Probably just started, and it's just, yeah, it's a new program. We're hoping, again, it's this pool of people that are using it. This is being funded through NYSOFA to be able to, they're paying for these slots. So more to come. If it's a successful thing, we would invest a little more money into it and give people that opportunity. But it gives, something during COVID that happened is, when your physical senior center shuts down, we wanted to find alternatives to that. And this is one of the things that came up for that. So this is something we'll be doing all through 2020. So then unmet needs, I'm not going to read through this list, but this is something we always continue to keep our eyes on. There's always gaps, there's always holes, there's always new things that need to happen in the community. And we kind of keep track of those things just in a list. But these are some of the ones that we've identified that we've heard continual complaints about that people have troubles with. Try to move the needle on those, filling those gaps, really. And I will say, because I don't think I mentioned this, but one of the most unmet needs, I did mention that, the home health aide shortage. We did directly hire a home health aide probably about a year ago at this point, which has been good. It's been a learning experience to try to navigate what that person does and how the program works, because we're not a licensed agency. We're a non-medical model, so we don't have to be licensed. And trying to just navigate the program, create it in a way that serves the people, but it's intended to serve our clients that are on a waiting list. So we have about anytime from 15 to 25 people that are on a waiting list waiting for an aide in the community, and they can't find one. So this home health aide can kind of fill that gap for them. They go in and serve them multiple ways. We're not under the same guidance as licensed agencies. We don't have to stay at a certain time. Somebody might just need a shower. That aide can move right from that shower to the next person and do something else for them. So scheduling that flow has been difficult, and identifying some needs beyond what that aide can do, and triaging that information between our case managers and us and the aide is where we've spent a lot of our time. We're trying to, perfect that. We're hiring another one starting the 1st of December. So, and some of those people have gone off our waiting list and have found an aide in the community, but at least there's something for them in the meantime. So it's been a good program. Yeah, so that's our unmet needs stuff. And budget. So it's kind of probably hard for everybody to see this pie chart, but really it's you look at the funding sources at the bottom is what those pieces of the pie are broken up into. So you can see our county funding is right in line with our state. We have a very supportive county government that's funding a lot of these programs and services that we offer. But these numbers have not changed too much. It's pretty consistent. We're up a little bit from 2022. And you can see that in the next slide. So I highlighted the ones in yellow are the decreases, and the ones in green are increases. So you can see where these come from. Some of them are grants. The federal title programs are at the top, and then locally funded, and our New York State funding is in there too. One of the bigger ones that I'd say is our unmet needs program. That's doubled in the last 2 years. They've provided us more funding through the state, and that's how we are funding our home health aides, because it's really truly supposed to be used for people that are on waiting lists and that are in those gaps. So you can see the funding is not much different from 2022, but that was a great increase for us to see that and to put that money toward. And last but not least, I wanted to thank Will Lawrence, and if she's watching out there, we've got her up here. She is one of our board members. She's served us since 2017, 2 terms, and her term ends this year. We were not able to have our last meeting. Our schedule shifted with our public hearing this year. So this will be our last meeting of the year. We don't have one in December. We just want to thank Will for everything she's done. We're going to probably try to still pull her in on maybe even on the board, but in other ways. She works with us really extensively on our age-friendly work and in her own community too, trying to get Caroline is an age-friendly community as well. She's done a lot of work with statewide senior action, worked in many volunteering roles. So we'll definitely miss her, her presence at our meetings. I just want to say thank you to Will. And I guess that just leaves us with questions. So maybe if anybody has any questions, I mean, online or here live. I also have some comments that were given through the survey, if anybody's interested in hearing those, and we don't have a lot of questions. Have any chats on there, Karen? So Karen's going to come over with the microphones, and or do you want to just use the microphone over there? Okay. Oh, isn't that interesting? Wow. Oh, okay.
Hearing of that, I guess.
Anybody have any questions? Oh, good question. So Carolyn asked about the Medicaid assisted living program in Tompkins County. We do not have one. There was an applicant, let's see, back in the end of 2021. We were supposed to find out in 2019. We were supposed to find out in March of 2020, and we all know what happened in March of 2020. So that application process got stalled. Found out recently that they did not get approved, and there's a moratorium on elk beds once again. So meaning yeah. And from what I understand, I've had a couple of meetings with Lisa Holmes, our county administrator, and also some different people in the community, that they're trying to revise some kind of regulations at the state level. They won't be ready till 2024, meaning the moratorium probably will go on until at least then. So we're still in the same place, fortunately. Sure. So like the health insurance counseling? Okay. Yeah. So, you can always call us here at the main number. We have 3 counselors in the office, and Lifelong, it really is our subcontractor. They coordinate the program. And so our high cap coordinator is Mary Ann Reeder. And there's how many volunteers do you guys have that do it? A dozen volunteers over there that do that. So you schedule appointments at your front desk as well, right? They call. Yeah. Yeah. So, and I think you have a couple open, they might be full. They have a walk-in clinic, so they coordinate all that. But again, we do high cap counseling all year round. I mean, it's not just during open enrollment. And Rodney Main is one of our counselors, Amy Jackson and Dawn Sprague are our counselors here. So you can make an appointment anytime. And if we're full, we refer to Lifelong. And if they're full, they refer back to us. So it's a good partnership. You have a question?
You don't have any.
It is separate. I think our biggest relationship, and it's not even a relationship necessarily, is through our age-friendly process. Because to become an age-friendly community, you have to go through AARP and be designated. And then you're kind of open up to a pool of resources and tools to help you. They do have a lot of resources that we've used. They have booklets and guides that we can get in print material that we've offered to people, but no direct support or funding or anything like that. Yes. Question. Yeah, that's a great. That's a good thing for us to look into. We could put something together. I mean, I know that, our aging service specialists spend a lot of time helping people apply to programs, particularly SNAP. And we do the HEAP program. People were more nervous this year, are more nervous this year. Heating costs my own heating costs are outrageous. I don't know how people on fixed incomes they're struggling. We don't know how more funding will be coming our way. Usually HEAP is like a block grant. And when it ends, it ends, This year I'm wondering, we don't really know. And food costs, as far as the food costs that we have provided for funding for like FoodNet, their costs are going up. So we've provided them more funding to be able to provide those home delivered meals. The prices of gas have, our drivers. So those kinds of things. It's a difficult time. A lot of these comments in here about transportation, not finding transportation, not finding drivers. Those are huge problems that are not easy to fix,
Could you just repeat his question, please, for the?
Oh, sure. Well, looking for strategies on inflation issues, I guess, groceries, shopping, heating, things like that. So we'll look into that more and kind of try to put something together for people, because I think that's a really great, that's a great idea. Yeah, sure, please.
So we try and now some other.
I'll just try to put that in a nutshell, Don. Is just mentioning part of the aging service specialist roles is to really help people navigate these systems, not just navigate them, but to figure out where we could help people save money. They have access to all sorts of resources, not only, if their benefits are ending or they've maxed out all the benefits that we know of other places where people can access. And we do make it our business to know that the most we can know in the community to get people what they need. Did I sum that up? Okay. Okay. Yeah.
So we do have a question
Sure.
online, and it is, why is nobody doing?
Saw that in my comments here, and that's a good question. And that I don't have an answer to, honestly. There was a few different transportation questions here about, the lack of routes, TCAT, taxis. I'm going to have to look into that a little bit more, maybe through our advisory committee, Charlie. We have an advocacy subcommittee that works on some of these issues that, don't have the easiest solutions to. So maybe that's something we can look into. I hadn't heard that about doubling the taxi rates. So we'll look at and see what we can do. Would you like to hear some of these? I'll try to sum up some, but there was quite a few things about the programs and services and that people weren't aware of them. And, just reminding us that, outreach and maybe summing it up on the Human Services Coalition a little bit more, just to let people know what we have available. People have commented about the dispatching of ambulances, the issues with bangs, issues that, they didn't have a phone that connected. Someone was in a motor vehicle accident. It was a concern for people in rural areas. I hadn't heard that much about that either, but we can look into that a little bit more. I do know that there's a shortage of EMTs and drivers in the community, just like almost every other program. Let's see. Somebody suggested a caregiver support group, which I think is a great idea, and we're actually doing that. We have that on our website, all the information, and there is a caregiver newsletter if anybody wants to get signed up to that. There's right here, but you can always call our main number to get signed up to that caregiver newsletter, and it includes everything that we have going on, our workshops, and more information than that even.
Yes,
Yep.
it's hybrid, in person and Zoom.
A hybrid model, yep. See. Think of something we haven't talked about here, or just find something we haven't, I forgot I have glasses.
Here's a question.
Yeah,
Rodney next to me.
oh, that'd be great. Would you want to come over here and talk to this, Rodney? People are concerned about the, winter getting around. You just kind of have to.
Sure, yeah. So can you hear me okay? Someone will.
Someone will comment, yep.
Anyway, so I'm part of the Snow Coalition. Well, our office is the Office for the Aging, Finger Lakes Independence Center, Bike Walk Tompkins, and some other community members. Joanne was part of it for quite a while, just a few months. And there's a question here that says, I really like to walk. With winter approaching, I was interested in the city's initiative to try and address snow removal on sidewalks, particularly at crosswalks. And the short answer is that the city does not have an initiative to do anything about it. They are responsible, Department of Public Works in particular, are responsible for clearing streets, and property owners, business owners that are responsible for clearing sidewalks and the crosswalks and curb cuts seem to be no man's land. The coalition for snow-free sidewalks was working very hard, feverishly over the summer before the budget season with the city to get a pilot program funded with the mayor's budget to see how much it would cost and also clear some heavily trafficked corridors in the city as a pilot. And it was, we lost the vote out of 4 out of 6 votes were received. So in favor of it. Department of Public Works wasn't in favor of it. The mayor didn't seem to be in favor of it either. So we are continuing to work hard. Some of the new directions we're going with it is, well, one, to garner more public support and have people's voices heard, but also to work with other agencies. Ithaca is a disability group in Ithaca, wants to partner with us and support each other's initiatives. So I think that's the way we're going to go to kind of get more, raise more awareness and have more voices from the city. What's that? Yeah, so I think that might be part of it. Is it due to staffing issues was the question. I think that might be part of it. That's definitely something we've heard. But there hasn't really been open dialogue between our group and Public Works either. We've been present at some city council meetings and things like that and held our own public forum. But there hasn't been direct communication between us and council members or us and Public Works to try to have some common ground. That's something we're going to be working on this year. So we're actually resetting and kind of redefining our scope and what path we're going to take, because we were close in getting something done. but just unfortunately not close enough. So hopefully next budget season we'll be able to make this.
Thank you, Rodney.
You're welcome.
Just some more comments that were made, again, snow shoveling. I think this is more referring to like in a driveway. We do have the list, but again, that's, we need more volunteers. I mean, this list is only as good as the people that are volunteering for it, or even paid people that are willing to maybe give a discount to a senior. I think it's important to mention that it's not just about getting out of their house, but some people need for access to them, their caregivers, their home delivered meals, the ambulance, whoever it might need to be able to get in their driveway is important. So more volunteers, better. People commented about small home repair. We do have a small home repair grant that we have with INHS. I think a subcontract I mentioned, which the county supports, and we also use our unmet needs funding for that. But there's never enough. There's also a waiting list for that. The people that not contractors, I can't remember what they're called. The home repair specialists, I think is what they call them. They were down a couple of them, like with all the workforce issues, so they really got backed up. But what we pay for is those small home repairs, weatherization type things, or something that needs to be adapted to fit somebody, whether it needs bars in their house or railings or special toilet seats and things like that. But they do have to qualify. So, it's usually the most low income people that are eligible for this program. So it's not always helping the people that have a struggle either end, but we do have something small. Somebody commented that they would like structured socializing, such as common dining facility where people could take turns cooking, or workshop where people could work together on projects. So there you go, Liza. Shoot that one out to you. And not just that, but I'll have to mention Love Living at Home too. I think, there's Love Living at Home is a really good partner of ours. They try to work beyond just their membership people and work in the community with us on projects. But that's a really good socialization group. There's a fee, there's a membership fee, but they do have scholarships for people if people are interested. So I'll just shout them out too. Did you see any other ones that stuck out, Karen? So a lot of them, again, transportation issues, medical transportation, which has been on our needs list for a while, particularly out of county. We've got some transportation options in county that need to be scheduled out, but being able to go to a specialist in Rochester or Syracuse, or to have somebody be a companion with you on those trips is a gap too, that we're always trying to find solutions for. I think of anything else that we haven't already talked about. Urgent care, ER wait times are too long. I don't know if I'm going to work on that one yet. Sure, I mean, I agree, but it's a big one to tackle with workforce shortages also. So we have questions online?
Yeah.
Comments will. Absolutely, and this will be recorded and uploaded to YouTube. The Tompkins County page, whenever Dominic does that, of course. So you can share it with people. Again, they can take the survey too until the end of November.
Thank you for bearing with us for
Yeah.
our hybrid. All your help.
Yeah, it is. You'd think we'd be used to it by now, but we're not. All right, well, thank you.